Good morning and welcome to NAMI New Jersey's weekly webinar series. My name is Maggie Luo and I'm the Associate Director in Communications and Technology from NAMI New Jersey. Today's topic is federal and state benefits program changes during the COVID-19 emergency. In response to the pandemic, as well as the social and financial impact on individuals, families, and businesses, our government has made various timely changes in the benefit programs that affect most of us in the mental health community. We are honored to have our distinguished speaker, Phil Lubitz, joining us again today. Phil is the Associate Director of NAMI New Jersey, where he leads our advocacy, public policy, and law enforcement programs. Phil has more than 40 years of experience in the public mental health system as a therapist, administrator, and family advocate. Phil currently serves as the chairman of the New Jersey Behavioral Health Planning Council. He is also responsible for adopting the state plan for supporting the family caregivers of people with mental illness. Phil was awarded the Senator Paul Wellstone Award for Mental Health Advocacy by NJAMA, and the Governor Richard J. Cody Mental Health Champion Award from NAMI New Jersey. And most recently, Phil won the prestigious 2019 Ann Klein Advocacy Award from the Community Health Law Project. So Phil, we're so grateful that you are here shedding some light on this important topic for us. So I will now pass it on to you.
Thank you so much, Maggie. Well, today we're going to do a survey of the many federal and state changes to programs that affect people with a mental illness as a result of the COVID-19 emergency. I want to mention that this is a very quickly changing environment. There are new things coming down almost daily on this. So we will have some resources at the end of the presentation that you should regularly look at so that you can keep up to date. I also want to say that many of these changes are temporary. They're in effect now, but they will be ending at some time when the actual emergency ends. One last disclaimer, today's presentation, we are not offering legal advice. So you should keep that in mind as well. Okay, so why don't we get started? So today's presentation is going to cover many benefit programs that affect people with a mental illness. We'll go over the legislative and executive authority for the responses. Excuse me. We're going to deliver the delivery of mental health services, the changes in health insurance, as well as HIPAA and 42 CFR, which is the privacy regulation regarding substance abuse treatment. Also some change to Social Security, some changes that have occurred in housing, homelessness, and food assistance programs. Certainly, there's been a lot done with both unemployment insurance and leave, family leave. We'll have a little discussion of student accommodations, what's going on in the courts, and lastly, we're going to leave you with some resources, both websites that you can go to and some telephone numbers. So on March 13th, President Trump declared a national emergency regarding the COVID outbreak. Basically, this gave the Secretary of Health and Human Services authority to make some changes, temporary changes, and to waive some requirements in Medicare, Medicaid, CHIP, the State Children's Insurance Program, and HIPAA. The first thing that took place, though, was Congress acted on March 6th for an emergency supplemental of $8.3 billion to put a good deal of money into some public health programs, funding research, community health centers, certain provisions waiving requirements that were in place about telehealth, and also the first of several attempts to give relief to small businesses who were affected by the emergency. The second Congressional Act was the Families First Coronavirus Response Act. This helped with food assistance, mandated free testing for COVID, an increase in the Medicaid match that states were receiving. So states, generally New Jersey would receive a 50-50 match. This increased the match by 6.2%. So a considerable amount of money with the over $1 billion that we receive in Medicaid funds. Some provisions in unemployment aid that we'll talk about a little bit later, as well as some paid sick and the medical leave that we'll be going over later as well. Next came the, what's known as the CARE Act. This one we probably heard a lot about, especially that each American will be receiving $1,200. I think some of you either have received it or will be receiving it very soon. That applies to everyone making under $75,000 a year as an individual. So in that one, for unemployment insurance, you not only would be getting your unemployment insurance, but it would add $600 a week to what you would be receiving. The CARE Act also gave some money to hospitals, additional money to food banks, made $500 billion in loans available to businesses. We'll talk about some mortgage relief, and it importantly delays student loan payments during the emergency. Next came the Paycheck Protection Program. We've heard a good deal about this as well. So this was really meant for business to maintain workers on the payroll. It also gave some money to hospitals and additional money to increase the availability of testing. So, you know, if you're following the dates on this, Governor Murphy actually declares a state of emergency before the federal declaration of a state of emergency by about a week. It essentially declares an emergency and gets New Jersey prepared to meet the spread of COVID-19. It allows the state to take emergency measures as necessary to protect the health, safety, and welfare of citizens of New Jersey. It also allows heads of agencies to promulgate rules and waivers and suspend, modify existing rules. We'll be getting into those in a minute. And all state agencies are authorized to take appropriate steps to address the hazard, including and eliminating barriers to their services, and to ensure the continuous delivery of state, county, and municipal services. So just last week, the governor issued Executive Order 138, and that extends June the 6th. So again, we talked about then that there are going to be a variety of both federal and state waivers to respond to the COVID emergency. So first of all, providers are encouraged to provide medical and mental health services through telehealth. So during the emergency, we're trying to maintain personal distance. This allows health services to be delivered in other than a face-to-face circumstance. So it allows health providers then to bill Medicaid for just about all the services they provide, and by providing telehealth rather than face-to-face services. This also waived pre-approval or prior authorization requirements, allowed psychiatric screening services to provide their service through telescreening evaluations and telepsychiatry evaluations during the public health emergency. Partial care programs or day programs were allowed through this waiver to provide their services by telehealth. And in the state of New Jersey is allowing them to bill a per diem or a day rate based on the telehealth that they are providing to consumers in their programs. So CMS, Center for Medicaid and Medicare Services, also through a waiver allowed facilities, including psychiatric residential treatment facilities, to receive full reimbursement in the event that they had to change their location. They had to change their office and move patients to unlicensed facilities. So as long as the state makes a reasonable assessment that those facilities meet minimum standards during this emergency, if psychiatric residential treatment facilities have to move to a different facility or provide services to a subset of consumers in a different facility, CMS is going to allow some room to for billing. And also during this time, CMS is waiving and granting temporary delays for scheduling and Medicaid fair hearings and issuing fair hearing decisions. So the state of New Jersey has established some guidelines for those agencies that contract with the Division of Mental Health and Addiction Services. One, they're encouraging all providers to establish strategies for contacting consumers, clients, and families during the emergency. So even with the emergency, agencies are still required to maintain contact with the people who they are serving. They're encouraged to consider alternate site locations as needed, and also to review their current staffing, determine what are essential functions and what staff requirements are determined by needing certain qualifications in order to continue to provide staff to maintain their operation even with a reduced staff. So, of course, this includes temporary policies to permit staff to work from home for functions that do not require staff on-site presence. And remember, a good deal of the services are now being provided through telehealth. And lastly, during the emergency, all providers are given the flexibility to use all available and appropriate technologies to deliver telehealth, as long as they are able to maintain a standard of care. So what is telehealth? So telehealth is the use of a variety of electronic information telecommunications technologies that allow support, long-distance support, and clinical care, as well as professional health-related education, public health, and health administration. This include a video conference, the internet, store and forward imaging, streaming media, landlines, the old landline, and wireless communications. There are going to be some guidelines with this as well. Providers should always use private locations and To the best of their ability, consumers should not receive telehealth in public or semi-public settings. And if it is absolutely necessary, consumers should give the ability to give verbal consent, whether or not they are accepting those situations. So telehealth can be used in all those situations where professionals believe they can provide their services during this emergency. And those services would include diagnosis or treatment of non-COVID-19 related conditions, such as mental health counseling and adjusting prescriptions, among many other things. So, you could have a medication appointment. The doctor could phone prescriptions into pharmacy, all being done with telehealth. But again, professionals are cautioned when using telehealth that the technology they use should really only be visible to the consumer receiving that service. So you wouldn't want to do something that broadcast on a TV screen, say, where many people could be a party of the conversation. A quick mention of a resource license, and I give you a URL where they can be reached. This permits people who are recipients really of a variety of benefit programs such as Medicaid or food stamps to receive free or reduced rate telephones, which could include smartphones. I think there are 2 companies in New Jersey that are offering that. So that would certainly assist with receiving telehealth services. And a couple of the companies in New Jersey have, during the emergency, also increased the amount of minutes or data that people are able to receive for free or low cost during the COVID emergency. So again, you can go to that URL and find out more about that. So some changes, modifications to family care, and which is the state Medicaid program. So the governor's orders and the president's state of emergency allow Medicaid to cover testing and visits for testing and testing related services without any cost for COVID-19. Also, that would apply to CHIP, the Children's Health Insurance Program. At this time when many of us don't want to be going into stores every week or even every month, Medicaid is now permitted to cover a 90-day supply of prescriptions of maintenance medications. And again, they encourage providers to use telehealth for routine visits where those options are available. It directs hospitals to waive the cost sharing for uninsured individuals who are eligible for charity care for testing and testing related services. And also, no one will lose their Medicaid or CHIP coverage during the emergency. So this is important, even if you have a redetermination scheduled during this time period, or there are certain requirements for payments to a Medicaid managed care company that comes due during this period. Medicaid and CHIP are requiring that your coverage not be ended while this emergency is going on. So there have been some changes to Medicare as well. Medicare was a little more particular about what services could be provided, as well as telehealth. But just recently, Medicare offered a 1135 waiver that includes provision of telehealth, including in the patient's place of residence. This would include doctors, nurse practitioners, psychologists, and licensed clinical social workers. They've also increased the payment for some telephone encounters to match payments for similar office and outpatient visits. Again, like Medicaid, Medicare is attempting to bring the reimbursement rate for telephone encounters up to what would have been the rate for face-to-face visits. Again, there are a bunch of services you can receive through telehealth, including counseling and preventive health screening. And again, things like partial hospitalization programs, psychotherapy, group psychotherapy, and patient education can now be billed as telehealth visits. So some more changes to Medicare. The Office of Inspector General has provided flexibility to reduce or waive coinsurance deductibles for telehealth. Medicare has a requirement that for telehealth billing, you would have had to have established a relationship with a patient or consumer. During the COVID emergency, really to encourage new people to receive services, Medicare is relaxing their audits of those claims to allow flexibility to allow people who do not already have an established relationship to get into treatment. And then there's some things like virtual check-ins. It's a little bit different than a face-to-face and an e-visit. That there's going to be some flexibility in billing for telehealth services for those two services. So HIPAA and changes is required by current emergency. So, there were requirements certainly for telehealth that technology was very specifically able to guard privacy. And this has been somewhat relaxed during the COVID emergency, just necessitated by not everyone having that technology. I think the federal government, this Office of Civil Rights, decided it was more important to make sure that people were able to receive services, or so important that the counterweight of privacy was lessened. So during this period of time, they're going to waive potential penalties of HIPAA for violations against healthcare providers. I'm sure if some really egregious violation, those could be heard after the emergency is over. Okay. So Secretary Azar, and again, the president's declaration of state of emergency granted the Secretary of Health and Human Services certain authorities to waive sanctions and penalties. And one of these is regard to HIPAA, is the Secretary Azar has waived the requirement to obtain a patient's agreement to speak with family members or friends involved in the patient's care during the COVID emergency. Also, the waiver, the emergency waiver, permits disclosure of protected health information for treatment purposes and certain disclosures to disaster relief organizations. Again, these will be in effect during the time of the COVID emergency. The CARES Act also made some changes to 42 CFR, the substance abuse privacy law. You know, primarily it had some of the very stringent particulars requirements for an agreement to disclose were modified much more in keeping with the standard that's used in HIPAA. So the requirement, the CFR requirement for written consent is still in force. However, once that written consent is given, it results in some flexibility for the relation for treatment, payment, and healthcare operations. It does require that entities make reasonable effort to comply with the patient's request to restrict disclosure. It also creates a new anti-discrimination provision that prohibits the use of the substance use treatment information, discriminate against individuals for healthcare, employment, access to the courts, or social service benefits, and including the sale or rental of housing. And also that the substance abuse data can't be used in civil, criminal, administrative, or legislative proceedings without a court order or the patient's consent. So there's some protections that were also put in when some of the provisions were waived. So, you know, many people have lost jobs and lost incomes. This certainly affects people's health insurance. Many people receive their health insurance through their employers. So just to know that family care, Medicaid can provide health insurance, low-cost health insurance to residents who are citizens of the state or qualified immigrants. That would be someone who's a legal immigrant with 5 years of residence in the country. So children are eligible up to with family incomes of $7,700. And parents and caretakers are also eligible for family care. Those are the income standards. Certainly adults with dependent children, some additional income standards. Pregnant women are eligible. And of course, the age blind and disabled program, including long-term care. So this includes our SSI recipients. But people are also eligible for what was known as Obamacare or the Affordable Care Act in New Jersey. That's called Get Covered New Jersey. So typically in the ACA programs, there's a specific time period when individuals are allowed to enroll, and that time period's passed. However, during an emergency, there are provisions that allow people to enroll. Again, this is low cost or subsidized health care. If you've had certain life events, and one of those is loss of coverage because of something like you being laid off from work or your business closing down. So you can go on the marketplace and you are eligible to buy insurance that way. So you have a time limit on that. So you have about 60 days after that qualifying event to enroll in a plan. And if you miss that time period, you're going to have to wait again to next year's enrollment period. I think generally falls in the late fall. And in New Jersey, an individual earning up to close to $50,000 a year, or a family of four with income of above $100,000 can still qualify for financial help. And again, to go to the marketplace at healthcare.gov. So services for undocumented New Jerseyans. So there's some legislation that's been introduced in New Jersey, some benefits for undocumented New Jerseyans. However, those are still in the legislative process, have not become law. So as far as what is available, testing for individuals who've developed symptoms of COVID-19 is available. You can be, if you meet that qualification, you can be tested at many public testing sites around New Jersey at no charge to you, regardless of your immigration status or whether you have health insurance. And immigration, ICE has confirmed that testing and treatment and preventative care related to COVID-19 will not negatively affect an individual's public charge analysis. And this was a Trump administration policy newly enacted that basically we're saying people who were receiving public benefits either would not be eligible for citizenship or would harm their consideration for eligibility for citizenship. But during this emergency, testing, treatment, and preventative care, it's been confirmed with ICE, will not negatively affect an individual's public charge analysis. So the Department of Banking Insurance has sent out a bulletin to insurance companies in the state, advising them to waive all cost sharing for emergency room. And you know what, this is going to get very wordy. So I'm just asking you read through this because it has to do with those charges if provider is in your network or out of your network. And it changes a little bit for each of these, but for emergency visits, urgent care, and office visits, depending on whether the person is in or out of your network, banking insurance has advised carriers to waive the cost sharing. They've also advised carriers, your insurance company, to inform you about the waiving of costs and how to access care as necessary. And make sure that their networks are prepared to handle the potential increase in need for services during the emergency. To develop robust telehealth programs. So it's not only the public sector that is to develop telehealth, it's also the private sector as well. Cover the cost of immunization when and if the vaccines become available. Expand access to prescription drugs, and that would really include, extending the period of time to be able to fill regular ongoing medication, and also to treat COVID-19 at a drugs to treat COVID-19 at a preferred level of cost sharing rather than one of the more expensive levels in their formulary. So to pay, then one of the ways they're encouraging telehealth is to pay in-network health professionals at the same rate as if they were doing office visits, and also grant requests for in-plan exceptions for individuals to access out-of-network telemedicine services. So if those services aren't available in your network, you're able to access them out-of-network telehealth services. The out-of-network provider would be paid at a rate of the in-network provider. So other health coverage changes. Hospitals are asked to refrain from imposing cost sharing on uninsured individuals. I think we mentioned that before. They're also to waive cost sharing for laboratory tests, right? This is your co-insurance. For the state health benefits plan and the state educational health benefits plan, all cost sharing for emergency rooms in and out of network, urgent care in network, or office visits network associated with medically necessary testing for COVID-19 are waived. Again, pharmacy benefit managers lessen the restrictions on early refill of medications, maintenance medications. This is again in the need to frequent pharmacies. Third-party administrators for the health benefits and state education are to inform beneficiaries about the availability of telemedicine and telehealth services. So also extra time for participants and beneficiaries of ERISA group health plans. These are usually large health plans or self-insured health plans. This is to allow you more time for file claims and appeals, but also if you need to apply for COBRA. This is insurance that it's a continuation of your employee or employer insurance should you be laid off. Generally, there's a time limit to apply for that. That time limit has been extended. So Social Security has also made some changes. During this emergency, all Social Security offices are closed for public face-to-face service. Okay, so Social Security is strongly recommending that you go online. I give you the URL for the online services. Going there to that website, generally Social Security has an excellent website, and going there the other day, they do have a number of circumstances that you can click on and get help. So again, strong recommendation, if you need Social Security services, is to go online. Or calling their field offices, and here we have a link to the field offices, or they have an 800 number. That's a national number. You know, just their warning is that there could be long waits for service on that number. So during the emergency, they will not start or complete any medical continuing disability review or determinations once a person reaches age 18. Okay, so this is not a new determination. This is someone who is already receiving Social Security would be up for a review of their case. Also, if you are applying, they've extended the deadlines for documentation or other information to be submitted. So there are no in-person or video hearings. They will, upon request, hold telephone hearings whenever possible. So we said as part of the legislation Congress passed that there's some new provisions both for unemployment, but also something called an economic impact payment, or EIP. So this, you may have heard that people are to receive $1,200 economic impact payment. Again, many people have either received them or will be receiving them very soon. So if you filed a 2019 or a 2018 tax return, it's automatically going to be sent to the bank account provided on your tax return. If you requested a check, checks will be coming, but it's going to take the government longer to write a check than it would have been to make a direct deposit to a bank account. So if you did not file a 2019 or an 18 tax return, the IRS plans to use the information provided by the Social Security Administration to help. So the IRS will generate your economic impact payment using the same method, direct deposit, direct express, or check, by which your monthly benefit is sent. So again, you receive Social Security and did not file an 18 or a 19 tax return, IRS is still going to issue that return to you, either through a direct deposit or sending you a check. Again, the same way that you receive your Social Security benefit. Although this is not, again, this is not a Social Security check. It is a payment from the IRS. So if you are not on Social Security and did not file a tax return, there is a URL that you can go to and enter some information to get that $1,200 payment sent to you. In addition, there was an additional $500 payment that would go to those who have dependent children, and the time period for filing that has closed down. So if you've missed that filing deadline, you're going to have to wait until you file your income tax for the current year, and at that time you would have some eligibility to receive that additional payment for a dependent child. So the governor's executive order states that any lessee, tenant, or homeowner or any other person shall not be removed from a residential property as a result of eviction or foreclosure procedures. So for the time being, at least, no one can be evicted or foreclosed upon in a housing situation. That does not mean that a landlord or bank cannot file for that foreclosure or eviction, and we hear that is occurring in some places. But at least during the current emergency, even if that has an eviction notice has been filed, you cannot be evicted. I don't believe the courts are holding those hearings. Also, for renters who are unable to meet their rent, they can direct their landlord to use their security deposits to pay rent, whether that makes up the entire shortfall or pays it in full. The caveat on that is that that essentially is only a loan. And at the end of the COVID emergency, people will be expected to refill the amount of the security deposit that they had previously used for rent. So also the New Jersey Housing Mortgage Finance Authority has suspended all rent increases for all eligible properties within its portfolio. That's about 36,000 rental units around the state. Many of those are rental units that people through the Division of Mental Health Services who are receiving services from Division of Mental Health Services have received their apartments. So that's good news. There won't be a rental increase. And also I'm leaving a URL here for you to see if you are eligible for any of the state housing assistance programs. So there are a number of programs, more than we could really go into, and well, we should say they deserve a presentation of their own. But if you'd like to see which you may be eligible for, go to that URL. Very informative. Also in New Jersey, there's something called rapid rehousing. You know, I don't know that we'll serve every person that's going to need housing, but it is available to an extent. It gives assistance to individuals and families living on the street or an emergency shelter, and allows them to obtain emergency or permanent housing. So rapid rehousing will pay up to 1.5 months rent, with rental assistance up to 12 months, a deposit for electric, oil, and gas, and also the moving costs that are associated with moving into housing. So here, every county seems to have an agency that is working with the state on this rapid rehousing. So here I have a URL where you can find the telephone numbers or locations of those programs. SNAP or food stamps. So you can apply online at newjerseyhelps.org, or you could apply by phone. I believe later on in our resources we have a phone number. So during the COVID emergency, they've simplified the application process. There are also extra SNAP benefits now. In some instances, there are work activities that were associated requirements for SNAP recipients. But during the public health crisis, your case will not be closed if you are unable to participate in a work activity. And for recertification, if your case is due to be recertified, and during the next couple of months, your case has been granted a 6-month extension. With a lot of these programs, the timeline, or we should say the deadline for taking certain actions, submitting certain information has been extended. But let me warn you that the guidelines differ from program to program, and it's much better to be safe than sorry. You should confirm if a situation like this pertains to you. You should confirm with the particular agency that they've extended a deadline. And again, at the end of the presentation, you're going to find some resources, both internet addresses and telephone numbers, where you should be able to confirm. So uninsurance employment, again, many people have either lost their employment or they've lost hours in employment. Both of those situations, to a large extent, make you eligible for unemployment benefits and some of the enhanced benefits as a result of the COVID emergency. So especially independent contractors, and those are self-employed or gig workers, those looking for part-time work, you're eligible for what's called the Pandemic Unemployment Assistance. Okay. So those who, under normal circumstances, you don't have enough work history, or you've already exhausted your regular unemployment benefits, you may be eligible for this pandemic unemployment assistance as well. Okay. So again, your URL there is myunemploymentnj.gov. So go there and check on that. So workers who lost employment or hours during COVID, a new law prohibits employers from firing or demoting anyone if you took time off because of COVID. So one of the enhanced benefits, unemployment insurance will provide an additional $600 a week on top of the regular and pandemic assistance benefit through July 25th. These payments will be issued separately from unemployment benefit. Again, so if unemployment generally pays two-thirds of your salary, you know, some people have pointed out that it is possible to, under this pandemic unemployment compensation, to actually earn more for a given period of time than you would with regular working salary. And also, unemployment insurance is giving you an additional 13 weeks of benefits for a maximum of 39 weeks. So other than the regular 26 weeks, you have 13 extra weeks up to 39 weeks. You know, there's a possibility that that may be extended in the future, but for right now, it's 39 weeks. Okay. Generally, so unemployment is going to pay you 60% of the average wages with a maximum of $713 a week, but then you are likely eligible for that additional $600 a week as well. So there are some additional employment benefits. New Jersey earns sick leave, so all employers must provide full-time, part-time, and temp employees up to 40 hours of earned sick leave per year so that they care for themselves or their loved ones. As part of some of the new legislation, there's emergency federal paid sick leave, where you could get 2 weeks of paid sick leave at your regular pay rate when you're unable to work because you are experience COVID symptoms and seeking a medical diagnosis. And then 2 weeks of paid sick leave at 2/3 of the employee's regular rate because you were unable to work because of need to care for an individual subject to quarantine or to care for a child. Okay, so these are two new benefits that if you can't work because of those particular circumstances. You also could be eligible for temporary disability insurance provided through the state of New Jersey. That's there for workers who suffer an illness, injury, or other disability that prevents them from working and wasn't caused by their job. And also in New Jersey, we have a family leave benefit. Provides New Jersey workers cash benefits up to 6 weeks. Again, for a newborn, newly adopted, newly placed foster child, or to provide care for a seriously ill or injured family member. So if you have a family member who's been impacted by the COVID-19 and it's necessary for you to be there to care for them, New Jersey has this 6-week paid family leave. So some and fairly new rulings for student accommodations. So as a result of the emergency, districts are still required to offer special education services to the most appropriate extent possible while students are away from school programs. Schools are directed, counseled to talk with parents who are key members of an IEP team to get their take on how best to meet the needs of a student with disabilities, you know, while they are home due to the COVID emergency, and really how to make the best out of home instruction to make sure that even with a disability, their child is still receiving equitable home services. IEP teams also are going to need to consider compensatory services when the student returns to school, and IEPs may need to be adjusted. So it's not only during the time of the emergency, but as a result of emergency, it's given that students with disabilities will not be receiving, or likely not to receive, all the services to which they're entitled. There should be some adjustments made once they do return to school to help them make up for that. And it remains the responsibility of the sending district to make sure that even students, if they are out of district placement, are still provided with instruction during the school closures. And the newest piece of news is that it's not permitted to schools to execute a waiver or release of present or future claims as a condition to implement a student's IEP. So the school district can't say to you, in order for us to give your child the special services called for in his IEP, we want you to sign a waiver or release the school from future liability. Again, that has been ruled to be illegal. So, you know, you're entitled to the services of your IEP without any additional conditions being placed on that. So that brings us to court operations. So on April 24th, the courts issued a ruling, and again, this is after the state of emergency, that resumes the operation of some courts and extends a deadline for other court sessions and activities. So until May 31st, the courts have suspended jury trials. Remember, we said the landlord-tenant trials, that has to do with eviction, or grand jury proceedings. However, civil commitment hearings already have resumed and will continue. I imagine many of those are taking place through video. Municipal court sessions, it looks they've were able to resume this week by video or phone where possible with the consent of the parties. Again, foreclosure motions or judgments received after March 1st will not be reviewed until further notice. And again, we'll reiterate the suspension of eviction of residential tenants continues. Well, it looks like the civil arbitration and the matrimonial settlement panels, they may have resumed in April, the end of April. And as we said, municipal court sessions can resume April 27th. So, let me reiterate that this is a very quickly changing environment. There are new provisions being added and new modifications of existing programs and rules, while at the same time, the time limit for previous declarations because of the emergency, like the court hearings we just saw, have ended. So my strongest recommendation would be to try to stay up to date with what's going on with the situations that most directly affect you or your loved ones. And again, there's a high demand for telephone service, and you may have to wait for quite a bit of time. Generally, most places, because of the reductions in staff, are recommending that you try to do as much as you can online. So for a number of things we talked about today, we've put up some additional resources. Also at our NAMI New Jersey website, www.naminj.org, we also have a number of additional resources to assist you during the COVID-19 emergency. So, we're aware that many people don't have access to the internet. So we've listed some telephone numbers, important telephone numbers, here for your use. And lastly, the state of New Jersey has a COVID-19 information hub, a wealth of information in all areas. I'd recommend that you take a look at that, both health information, how to deal with the COVID, information from the Center for Disease Control, just a wealth of information about that. And also links to many of the government agencies, as well as a general COVID line and a line for COVID questions, even being text alerts for COVID. Okay. Oh, when we went over the telephone numbers, I just wanted to point out as well, NJ, let me go back to that quickly. New Jersey Mental Health Cares, behavioral health information, helpline and referral service. And during the emergency, they have extended hours. So that's an important source of both information, or if you just need to talk to a friendly voice, that's a good place to go. Okay. So that concludes the presentation portion of today's webinar. So
thank you so much, Phil. Thank you. We will now be responding to some of the questions in the Q&A chat box. We have answered some of them online, but I know that we are going to overrun a little bit, but maybe we can take about 5 to 10 minutes to answer, Phil. So one of the questions that asked that are psychiatrists right now gathering urine screenings or blood levels that are required with prescription medications?
Mm-hmm. I'm sorry.
Right. So
I thought I was going to have access to the chat box, but I don't. So
that's fine. So I'll be reading. So one of the attendees asked, are psychiatrists right now gathering urine screenings or blood levels that are required with prescription medications?
That's a good question. I think they say that the services as required. So, I think you're going to have to speak to your provider directly about that. I know screenings and medications are being refilled. Again, I think we'd be in safest ground right now to say that you're going to have to talk to your particular provider about what he or she is doing in terms of taking blood levels.
Yes.
Again, the direction is just to provide the most appropriate care possible.
Right. Thank you, Phil. The other question is that will the additional $600 per week in unemployment stimulus make someone ineligible for continual NJ family care, the Medicaid program?
No, I think there's some flexibility of that. I think, my memory is that there's like a 3-month period for a spend down. So again, you probably cannot be over the $2,000 threshold for a long period of time, but that $600 or the $1,200 payment, right, that could easily throw someone over the threshold. That's not initially going to count against someone for the purpose of being eligible.
Thank you. And a follow-up question as well, that if the family has the permanent resident status or green card, will there be an issue during this pandemic period with public charge if they apply for food stamp benefits?
So the only one, to the best of my knowledge, the only benefit that the federal government has clearly stated will not be taken into consideration is the treatment of COVID, right? The diagnosis and treatment and care associated with COVID. Some of the other programs, again, I'd have to say there is a possibility that would affect the public charge determination.
Thank you. And the next question is that when, Phil, you are referring to the waiving of emergency room costs for COVID-19, does this also apply to the doctor's charges that are usually billed separately from the ER charge?
It should, yes.
Okay, thank you. And also there's couple more. Like, can we apply for unemployment while being on SSI?
If you were employed during the time you had SSI and you that didn't take you above the income threshold, yes, you could do that.
Okay, thank you. And will that unemployment benefits be able to issued out retroactively if they apply, let's say, a month late?
I think unemployment, you start collecting benefits from your date of application. So my understanding is that you don't apply retroactively.
Okay, great. And someone also asked for family care, NJ family care. Phil, you mentioned on the slide that the $49,960 per family of 4. Could you confirm that information?
So, that's the sort of the gross figure that's given. Generally, there's some disregards in income. So there's a possibility that it could be, it's like adjusted gross income. So yeah, I can confirm that's certainly, if you're under that amount, yes, you should be eligible. That was recent. That was a couple of days ago.
Mm-hmm. Thank you. And someone on the line saying that they have applied for the unemployment back in March, but they're having some issues. No one was responding and they got hung up. So they wonder, what can they do? Is there an agency or some way to try follow up and get a response?
Yeah. Unfortunately, we have millions and millions of people who are unemployed. I think close to 1 million people here in New Jersey alone. So the unemployment office is really overwhelmed. And, I know both the legislature and the governor have certainly said that they are taking steps to ease the backlog, but we're really in an emergency situation, and I don't believe there is a very good workaround. You just have to keep at it with working through that website or phone number for unemployment.
Right. Thank you. Can an EIP be obtained by a dependent who has earned income?
Can because it's IRS, I would think it's either going to be either or. The person is no longer then a dependent. You're going to have to decide for the purposes of income tax if the person. And again, I'm going to caution you. Not only aren't you getting legal advice, but you're not getting accounting advice either. I would think offhand that a person would have to make a determination. Either they are a dependent or they aren't dependent. To the extent that you might have been claimed on a previous income tax, like the 19 income tax is a dependent, and that's what the basis of the payment is, I would be cautious about that.
Thank you. Mm-hmm. And the next one, when will the extended unemployment benefits for the 13 weeks begin? Will it include the extra $600?
Yes, that's already occurred.
Thank you.
I think that ends in mid-July.
Mm-hmm.
Again, the House of Representatives bill yesterday that intended to extend that, I believe, till the end of the year. But first it has to go to the Senate, and the Senate majority has voiced a lot of opposition to that. So whether it ever becomes law or not, it's certainly going to be something that's going to be interesting to follow, but it's not law yet. So at the current time, all we can really say is that, you have that extra payment for 39 weeks.
Thank you, Phil. So I think that the last question, because of the time, we do want to be mindful of that. So if someone is currently on SSI and is claimed as a dependent of another person, are they eligible for any kind of stimulus payment?
Again, I'm going to give the same answer. We're not giving either legal advice or accounting advice. So, rather than be incorrect about that, I'd rather not give an answer. I can say that for a deeper dive into Social Security, the Disability Rights New Jersey, which is drnj.org, is going to be giving a webinar this afternoon that probably will look a little bit closer at SSI in particular. So a person might want to go on their website and register for that one for some additional information. Other than that, those are questions we might be able to go to the Social Security website. Like I said, they have a very good website. They have the ability to answer a lot of questions. You might be able to go online and get that answer right from the horse's mouth.
Thank you so much, Phil. And from one of the other staff members, Susan, we would like to suggest to the attendees, if they have questions with unemployment benefits, you can contact your local state elected officials for help as well. So with that, Phil, I thank you very much for joining us and sharing with us these valuable resources. Right now, before we close, I would like to go back to our website. So before we close this webinar, we'd like to share with our participants our online resources and information from the NAMI New Jersey website. So from the front page, if you go to the Get Involved page and click Become a Member, you can find out all about how to become a member. That said, all our programs are free. And on our front page, you can go to the COVID-19 Information Hub that Phil mentioned. You'll be able to access all our online services and resources. You'll find where the statewide online support groups are, our affiliate online support group, multicultural, as well as signature presentations. We have a lot coming up here, and as well as a webinar like this one, where we'll be posting the recording along with the handout. So here is Phil's, and tomorrow we have a special webinar in Spanish. You're welcome to join us. And feel free to reach out to NAMI New Jersey for any support you might need. Thank you again for sharing this hour with us here today. And as a reminder, it would be appreciated if you could complete the survey at the end of this webinar so that we can incorporate your feedback for future webinars. This concludes our webinar. Thank you all.